While I was in dental school, my youngest brother was diagnosed with autism, and my grandmother was diagnosed with cancer. And I saw that oral health had an even bigger impact on their lives. Not only were they dealing with the challenges presented with the autism and also the cancer, but they also were struggling with increased risk for all these dental problems, and also finding it difficult to find a dentist that understood those issues and had the skills to help them with it. And so that's how I ended up wanting to specialize in special needs dentistry, to help other people that were facing similar challenges that my family faced. My passion for dentistry really started back in childhood, growing up and seeing my father struggle a lot with his oral health. My dad, because he had tetracycline staining, which made all of his teeth look black, it meant that he didn't even like to go outside and go out for a meal and smile at other people. He felt really isolated because he wasn't able to connect with others over this really simple gesture of smiling at someone else. And that was really devastating and heartbreaking for me to see my dad go through that kind of pain. And so this really led me to want to help others to have their smile and to be able to eat properly and to be able to integrate themselves into society. And that's what led me down the dentistry path. And when you compare that we have 20 specialists to care for 1 in 5 Australians that are living with a disability, and 47% of Australians living with a chronic medical illness, which is only going to rise because of the fact that we have an ageing population, you can see that our nation is facing a silent healthcare crisis. And now, my journey as a dental specialist has taught me even more about the importance of oral health. I have a lot of patients that have cerebral palsy, and I have a patient that comes in and she has a wheelchair and she communicates non-verbally. So her smile was a really important part of the way that she interacted with the world around her. And there was a problem where she ended up in hospital twice, and she almost didn't come out of hospital. And the reason for that was because she had inhaled dental plaque into her lungs, and that had caused a lung condition that she almost didn't recover from. So that really showed me that dental problems and oral health can actually be about life or death. And this is why I do what I do, and I look after the patients I look after day after day, because I really want to help make sure that my patients can continue to share their smile with the world around them.